Hello and welcome to Medical Dialogues. I'm Dr. Garima Soni. Here's what I bring to you all from the world of medicine. Brain pathway discovery sheds light on higher depression rates in teenage girls. Depression is a mental health condition that affects 280 million people worldwide. It is twice as common in women than men, and this pattern starts to develop during adolescence. Researchers have studied the biological processes that drive depression in adults and shown a potential role for the kynurenine pathway. But this is the first time it has been investigated in adolescents in relation to biological sex. This study was published in Biological Psychiatry using blood tests. The study assessed the levels of kynurenic and quinolinic acids in a group of 150 teenagers from Brazil aged between 14 and 16. The teenagers developed to one of the three groups: those with low risk of depression, those with high risk of depression, and those who had been diagnosed with depression. Risk was assessed using a measure that had been developed as a part of Identify Depression Early in Adolescence project and considers a range of factors. There were 50 adolescents in each group, and they were evenly divided by biological sex to explore differences between male and female adolescents. The adolescents were tracked over 3 years to assess if their depression symptoms persisted or improved. The study also measures specific protein in the blood that indicate the body is in an inflammatory state and are released during infection, stress, or illness. It is found that higher levels of these inflammatory markers were linked to increased production of neurotoxic chemicals in the kynurenine pathway. Notably, this association was found in adolescents at higher risk of with depression but in low-risk adolescents. This suggests that inflammation might drive the kynurenine pathway toward producing neurotoxic chemicals, increasing the risk of depression. In the follow-up 3 years later, the study showed that female adolescents with persistent depression had higher level of neurotoxic metabolites than those who recovered over time, suggesting that increased neurotoxic activity in the kynurenine pathway could make depression harder to overcome for some adolescents. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.